Stop the hemorrhage, an introduction to the soft T tourniquet and the OLAES Modular bandage. The soft T tourniquet, also known as the Special Operations Forces Tactical Tourniquet, is used mostly for arterial bleeds. We will be using the orange one. The OLAES Modular bandage, also known simply as the OLAES, is used for venous or central bleeds. So when would we use these? Whenever there is life-threatening extremity or external bleeding. And who would we use it on? We can use it on anyone. There is currently no age restriction.
Now stand aside, worthy adversary.
'Tis but a scratch.
A scratch? Your arm's off.
No, it isn't.
Well, what's that then?
I've had worse.
You liar!
Come on, you pansy!
The use of bandages and tourniquets is governed by the BLS standards. Currently, anyone who has ever taken a first aid course can apply a tourniquet. The following is a video that demonstrates how to apply the soft T tourniquet.
Today we're focusing on the soft tourniquet, or the Special Operation Forces tourniquet. It's a very simple tourniquet, very simply made. It's got your strap, your windlass device, your delta clip or your securing mechanism. It works off of friction and tension. This is your primary treatment for any extremity hemorrhage, any major hemorrhage. It's our first line treatment that we're going to be using. Even before direct pressure, wound packing, pressure bandage, we're going straight to the tourniquet for application. People, when applied, this can be left on for up to 6 to 8 hours, but with normal transport times, we're going to be at the emergency facility, within 30 minutes or so. So it's very safe to use. When applying it, I noticed that the person is hemorrhaging from an extremity. We're just going to take it, slide it over the extremity, all the way up. Once it's high up on the extremity, we're going to tighten the tourniquet, take all the slack out of it. Once it's tight, I'm going to turn my windlass device until the bleeding has either stopped or slowed down. Once that's occurred, I'm just going to secure it in the delta clip, and that's it. It's now secured. At this point,
Here are a couple of points to remember. The soft T tourniquet is generally used for arterial bleeding. Also, early application is key. Managing a life-threatening hemorrhage is a priority and should be done as early as possible. The phrase we'd like you to remember is high as you can and tight as required. While it may seem counterintuitive to place a tourniquet as high up on the limb as possible, there are several reasons for this. First of all, it ensures that the tourniquet is cinched around the required artery. Oftentimes, severed arteries can contract and pull back into the limb. It also ensures that you don't miss any other injuries on the same limb that may be concealed by the copious amounts of blood. Also, there's less risk that the tourniquet will slip off the limb. Once a tourniquet is applied, it should not be taken off except by a trained physician. Tourniquets must be applied tightly enough to completely stop the bleeding. It will be painful. Just a reminder that patients who sustain substantial blood loss are unable to maintain their core temperature. Thus, they are prone to hypothermia or hyperthermia. Next, we move on to the OLAES Modular bandage. The following is a video that demonstrates how to apply the OLAES Modular bandage.
The OLAES Modular bandage is vacuum packed to allow maximum packability. tear notches are located at the top, center, and bottom sides to allow rapid, easy opening. When opened, first remove the paper wrapper and discard it. Unroll the bandage and you will notice the pressure cup running down the center of the back of the bandage. This pressure cup also acts as an eye cup. Velcro brakes maintain control of the elastic bandage while using the bandage. These brakes are spread throughout the elastic to prevent accidental unrolling. To utilize the contents of the bandage, grip it in one hand and expose the flap on the front of the bandage. Pull the flap to expose the gauze and the occlusive layer. The gauze is Z-packed and completely removable from the bandage. The occlusive layer is also removable. These features allow you to treat multiple injuries or entry and exit wounds with a single bandage. To apply the OLAES Modular bandage, open the package at one of the tear notches. Discard the paper and unroll the bandage. Place the pressure cup directly on top of the wound. Release the elastic from the Velcro and wrap the elastic around the casualty. To secure the elastic, loop the plastic hook onto one of the previous wraps of elastic. To treat multiple injuries, open the flap at the front of the bandage to access the gauze. Remove the gauze and place it on the first wound site. Place the wound pad on the second wound site and secure both items with the elastic wrap. Secure the elastic with the supplied plastic clip.
Some key points to remember. The OLAES is generally used for venous or central bleeding. However, this does not mean that it cannot be used in conjunction with the tourniquet. The plastic cup on the OLAES bandage is designed to sit on top of the bandage, just over the wound. It adds extra downward pressure. Alternately, the plastic cup can also be torn off the bandage and used as an eye cup for eye injuries. The recommended patient approach for patients with a life-threatening hemorrhage follows the acronym MARCH, where M stands for massive hemorrhage. The goal is to stop the bleeding before proceeding to your ABCs, and thus this is your first step and your first priority. Next, the A stands for airway, R stands for respiration or breathing, C stands for circulation, and the last H stands for hypo or hyperthermia. This is just a reminder that these patients will have a difficult time maintaining their core temperature due to extensive blood loss. Any questions can be directed to the Toronto Paramedic Services Education Department or to your facilitator or instructor. Thank you. Now, let's practice.